I'm joined now by the Nigeria Chief of Health, United Nations International Children's Emergency Fund, Dr. Eduardo Celades. Thank you for joining us on TVC News at 7. We'll talk about the integrated vaccine campaign shortly, but I'd like to have your reaction to some of the harmful practices affecting the African child. One of these, of course, is child marriage. We're told that the continent is home to some 130 million child brides. There's the issue of child labor. Nigeria now having more than 15 million child laborers, the highest in West Africa. And you also recently voiced concerns about the high incidences of new pediatric HIV infections in the country. How challenging do you think it is to be an African child today, given your experience with Unicef?
Indeed, here in Nigeria, there are a lot of inequalities that are affecting children. And this is especially dramatic for early marriage and child marriage, and as well pediatric HIV and other of the issues that the children are facing. Every day, more than 2,000 children die for causes that we can avoid, like malaria, like pneumonia, like diarrhea. So we really can do much more in trying to save lives of children. Regarding child marriage, this is very much related with out-of-school girls, with teenage pregnancy. So I really believe that we need to work together as well with the communities and empowering the girls, empowering the boys, and as well working with traditional leaders, with community leaders to really end this practice.
We hear that Unicef, alongside other partners, is launching the first integrated vaccination campaign. What is this all about?
That's correct. We are very excited today. We are working with the National Primary Healthcare Development Agency, with the Federal Ministry of Health, with the government of Lagos, Ogun and Gombe, launching the biggest integrated campaign ever in an state. We are targeting only here in Lagos 6 million adults and children with a integrated vaccination campaign. An integrated campaign means that we are providing services like vitamin A supplementation, measles vaccination, polio vaccination, and as well COVID-19 vaccination for the caregivers, for mothers and children, for mothers, parents, etc. So this is the first one in their kind, and we really believe that it can have a dramatic impact really on this disease.
You're capturing children with the COVID-19 vaccines as well?
No. COVID-19 vaccines is only for over 18 years old. For children, we are doing 0 to 5 years old on polio, 9 months to 5 years old on measles, and 6 months to 5 years old on vitamin A supplementation.
You mentioned you're targeting 6 million adults in Ogun and Lagos State. How soon is this program expected to start?
So today was the flag off here in Lagos, and tomorrow will be in Ogun State. And we are engaging more than 30,000 people on the teams that they are going to be vaccinating in temporary fixed posts and as well in fixed posts. And we really hope that we can find and target all children, even the ones living in hard-to-reach areas, like in urban slums or riverine islands. So really, we address inequalities as well in this campaign.
How do you intend to take the program to the people, particularly in this climate where, not quite a lot of people are excited about things like this? There are more economic concerns that, take some huge priority with our people.
That's correct. And what we are seeing is like having an integrated campaign can really result in efficiencies, because we have bigger teams. Each team has 10 people, but we're avoiding having like parallel campaigns or campaigns one after the other. So we really think that this is more efficient. As well, for the mothers, for the parents, this is a great opportunity. They will have one stop for everything, for all the vaccines that the children need, and even the adults. It's only one shop stop. So you can get all the services, all the vaccines that you need in only one contact with the teams. So we really believe that this is an opportunity. And as well, it's an opportunity to really show to others, to your family, to your communities, that you love them, that you respect them, to your children, that this is the best way that you can do, right? To vaccinate them and to avoid unnecessary death and morbidity and morbidity.
How can Lagos and Ogun residents watching the show right now take advantage of this? Is there a designated place where this vaccination will take place?
Yes, so the vaccination campaign starts tomorrow and it's going to be until the 4th of July. This is going to start in 10 LGAs here in Lagos in the first phase, the first 2 weeks, and then in the other 10 LGAs. And at community level, we have been working with community leaders, with traditional leaders, with jingles in the radios. So it will be always a team close to you, in markets, in the schools, in the health facilities. So this is the moment to really get vaccinated, to really show love and respect and care for your loved ones and for your children. and as well to get your shot against COVID-19. So this is a great opportunity. We are targeting 4.7 million children and 1.4 million adults on this, over 18, for the COVID-19 vaccination. So really don't miss this opportunity.
Dr. Eduardo Celades is the Chief of Health with Unicef in Nigeria. Thank you for talking to us tonight.
Thank you very much for inviting me.